So my name is Toni Suihko. I work as a Chief Information Officer in Eksote, as you heard. Actually, I'm substituting my boss, Pentti Itkonen, who is the Chief Executive Officer, but he couldn't make it today. So I'm not going to talk so much about the IT things than this trend and changes, what is happening in the area of social care and healthcare generally. But there is a question part, then I might answer some questions, for example, relating to artificial intelligence, what we have done in Eksote, if you ask. Anyway, there is three layers in the changes and trends, what's happening in the markets and globally and nationally and regionally. As you know, people are getting more older, they are aging, digitalization is happening everywhere in globe, and the patient roles is changing. And this development is evidently, you cannot change it, it happens anyway. So if there are any persons from ministry, for example, finance or social and healthcare ministry, even though whatever you are doing, you cannot influence that. You may slow it down, or you may make faster this development, but you cannot really stop it. It's happening all the time. And the next level, what you can do in the ministry is build up legislation or set some rules to emphasize the integration for some of these services, or influence to them how you use money in regions and municipalities. That you can do. But really, the universal megatrends are the driving force, and we are just trying to adapt here in national level to it. And of course, what we are doing in the regional level, for example, my organization, we are ramping up new ICT systems, patient record system. We are setting up e-services for citizens. And of course, we are developing new kind of services, which are mobile services targeted to deliver these services to people's home outside the hospital. And we are setting up the integration, different kind of ICT systems for that, and also the new processes and models for that, and artificial intelligence as well. But nevertheless, what's happening globally, the megatrends, they are the driving force. And we have to adapt to those forces and trends in nationally and regionally. The different phases, what we have faced already in the Eksote part, is that the future is not ready at once. There are certain phases, and if you think the social and healthcare reform is what's happening in Finland, each of these regions has to somehow face each of these phases. So you will start separated organizations, they might be the municipalities, and then you are putting them together in this new organization. For example, it might be then this new region, maakunta, which has been legislated out, that there has been the reform is targeting to setting this organization up. And that's really, it's based to its administrative framework. And the good things happen after that. So if you are in different municipalities, the added value what comes out of is that you know really your customers and your area, and the value is in hierarchy, really. You can control what's happening there. And if you go to the bigger administrative framework, the added value factor is the same. It's focused to the organization and professional. Of course, you can get the added value from the economics of scales because you are a bigger one. But really, you are not focused to the customer at that time, really, at that moment, that phase yet. But then you are developing a bit, and then you are starting to figure out the processes, and you are connecting data together. And at that phase, like we are in Eksote at this phase, the value comes from the data. And what you usually get say that there isn't enough data, for example, in the healthcare and social care area. There is plenty of data. I mean, this data is hell of a lot of data. Only the legislation is preventing the reasonable uses of that data at the moment. But the focus is changing to citizen, not so much organization anymore. And what comes next is that not just the one organization, it's like the Kela, ministry, organization, THL, third sector, and private companies. Everything is connected together through data, and that really emphasizes that the whole ecosystem is focusing to citizen. It's going to be citizen-centric in the future. And if you think the development, what has happened previously in the past and what's going to happen in the future is that in 50, 60 years we were building up hospitals, different kind of premises and equipments. It took, this 50 and 60 years. But what's going to happen in the future, the development speed will be rapidly more intense than it used to be in the past. Digitalization is going to change the whole picture. Services are going to be delivered to people's home, and they are family and the citizen-centric services. This service, digital service design, digital decoration of this home, ethical and ethic thinking of these services will increase. They will be more citizen-centric. Same goes for the other technology, not just the premises or the rooms or the hospitals. The first phone up to computer took tens of years, maybe hundreds of years, but now we are in the age of wristband, and the development speed is rapidly increasing. And it's not just the equipment, it's just also the services, mainly the services, which you can use through these devices. So we are not talking about hundreds of years or tens of years, we are talking about years in the future. And the whole market is going to change because of these new services based to the new equipment and new, for example, software. And the technology will be around everywhere. It's around in the organization, in our patient record system or other systems. It's around in the houses of the people, homes of the citizens. There is the robotics there, I mean the physical robots, but also the virtual robot as well. And then people are also equipped with different kind of equipments. It might be some kind of monitoring device or something like that. And all these three elements are bundled together, which provides the information which is used in totally different way in the future to increase the wellness and well-being of these citizens. And what this will lead to a different kind of market in the future. I mean, if you think the past, how people were treated, for example, the hospitals, the past, I mean the bottom side there, for example, if you think the lung diseases, these patients were isolated in previous time. They had their own hospitals, separated in the forest or something like that. Actually, there was usually they were next to lakes, quite nice places at that time. Old hospitals are in the best places in the home country. And also the mental patients, they were isolated. And then we moved from this isolation. Well, of course, you don't have the drugs to treat them, so it was the idea that they don't infect other patients, other citizens. But then we focused in the past to build up new hospitals. I think most of the hospital has been built up maybe in the 50s to 60s in Finland at the moment. And of course, everybody are renewing those hospitals, building new ones, because they have come end of their days, those hospitals. And after that, we focused to economic value, investments, and the governance of this whole system. And still we are very focused to the organization, not really about the patients. And I believe that at the moment we are in the operational value phase. This is the whole thing that what's happening in the Sote reform at the moment. We are building up new kind of organizations with new kind of processes and new kind of information flow, which makes possible new kind of information flows in the future. But still, we are not focusing where we should focus. It's about the patient itself, and that's going to happen next. So we are going to move from towards the customer value, which means we are going. It really means I have to speed it up because time is short. We are moving from volume to value. So if you think our finance, how we are paying for a psychiatric treatment, we are paying from appointments at the moment. If you get 10 appointments as a private or public organization, you get some money from that. In the future, you are going to get the money if the people are more healthier. And that's the inevitable change which will happen. Hopefully it's not this kind of insurance-based thing that happens in the States because it sucks, but it might take some elements from there. And it's a very tricky thing. It's not so easy to invent these kind of new models to do the pricing. And I think this social and healthcare reform is one step, but it's not enough. It's going to change in the future towards this kind of direction. And then that really speeds us, public organizations as well as private sector companies, to make things that make people more healthier. And the vision is that we are going to treat people at their home. There is digitalization devices and that sort of thing there. And only those patients who need this kind of secondary care treatment will be taken care at the hospital, otherwise at home. And it will be the ecosystem service delivery, so not just the private or public sector organizations deliver services to home, also the third parties as well, local authorities. And we believe that by this kind of development, we can really push the cost and reduce the cost. If you take the aged people, the costs are starting to increase in cumulative way quite in the 70s when they are aged at 70 at the moment. But doing the right tricks, we believe that we can move it further. So the cost will start to cumulatively increase maybe in the 85 age. And the one thing about the artificial intelligence, we believe that that's the changing factor. Well, if you predict the future, you must see the Hollywood movies from 80s because they are telling what's going to happen, really. Hopefully not the Terminator, but other movies. There are some not so good things. But if you think the algorithms and artificial intelligence, and there is the picture of the person and the bear. What happens when you face the bear in the woods? You are probably getting scared. When the robot faces the bear, can you learn the feeling to the robot? Is there a certain kind of algorithm? Are we there yet, or when we are going to face that? Then we are quite near about the human thinking, which is really needed also in the future in the social care, healthcare treatment of the patients. And about the data is going to be the crucial thing. You know, people early days believed Zeus and Hera and other multi-gods in the Greece history. And then came this one god system, Jesus and Muhammad, Yahweh and that sort of thing. And people believed them. What are the people believing at the moment? They are believing Google, Facebook, Twitter, Amazon, and there's the fact. And of course it's going to change the things. It's not just the Bible or the doctor's Bible that they are believing. People are taking the control. But of course, there might be some other misinformation, like it was in the Bible or other church writings. There are also misinformation also in the internet. So what we are going to need the technology and devices and algorithms to make the data more true, to be believable data. And that is going to happen in the future, and maybe the whole thing was just being algorithm of universe. Thank you.